A 48 years old man noticed that becoming increasingly dizzy when plays squash. In addition, he has also developed cramping pain in the left arm. One day, he is inflating his car tire with a handheld pump. He collapsed and brought to hospital. What is the most likely underlying causes? Here are the options. Options are the aortic contraction, coarctation, cervical rib, patent ductus arteriosus, Takayasu arteritis, and subclavian still syndrome. So what happened? A man, 48 years man, when he plays squash, that means when increase working activity, that means when increase working activity. So when increase working activity, she developed cramp, increasingly dizzy. So dizziness develop, and also what happened, and suddenly collapse and brought to hospital when there is inflating his car tire and a hand held pump. That means in this condition also there is increased work. So when there is increased work in this condition, the patient is dizzy and sometimes collapse. That means loss of consciousness. So in this condition, what may be the underlying cause? First of all, let's see the subclavian still syndrome. So what is subclavian still syndrome? Here, this is a clinical pathological condition in which the proximal part of subclavian artery, that means the proximal subclavian artery, was occluded either by the stenosis or any other pathological condition. And what occurs? It results retrograde flow through the vertebral or internal thoracic arteries, and they result reduced cerebral blood flow. And for this condition, sudden syncope develop. Patient may become unconscious and fall from standing. And a duplex study or angiogram will delineate the lesion. That means the duplex study or angiogram, it will help to the final diagnosis of the subclavian still syndrome. So let's see, this is the subclavian still syndrome. What happens in case of the subclavian still syndrome? First of all, let's see, this is the arch of the aorta. So whole of the blood goes from the left ventricle to the body through this arch of the aorta. And here we can see this is the subclavian artery. This is the left-sided subclavian artery. First of all, it is the brachiocephalic artery, common carotid artery, and subclavian artery in the left side. On the other hand, in the right side, there is the subclavian artery. So what happens when there is the subclavian artery occlusion occurs? In this condition, we know the subclavian, it supplies whole of the upper limb. So the subclavian artery, it supplies whole of the upper limb. Imagine it is upper limb. So subclavian artery, it supplies whole of the upper limb. So what happens when there is the stenosis in the left subclavian artery? So in this condition, the left hand or left upper limb, what happens? It usually less blood supply or absent blood supply. In this condition, what happens? The brain located in this area. That means here there is the brain situated. So in this condition, what happens? The reverse blood flow occurs. Actually, what happens in case of the vertebral artery? The vertebral artery, it takes blood to the brain, and also the other vessels such as the internal carotid artery, external carotid artery. Actually, the internal carotid artery and vertebro-basilar system, they convey the blood in the brain. So the left upper limb, as there is stenosis in the left subclavian artery, it needs more of the blood supply. So for this condition, there is the reverse flow occurs. That means in the right side, the blood enters in the brain, but this blood then goes to the left. That means it is shunting, or there is bypassing the left subclavian artery. So from the brain, the blood goes now to the subclavian artery and finally goes to the left upper limb. For this condition, when the activity, that means when the left arm activity in this case is hugely increased, then left hand requires more oxygen, more food materials such as the glucose, amino acid, fatty acid. So in this condition, what happens? More blood comes to here. So from the right subclavian artery or right vertebrobasilar artery, blood goes to the brain, but this blood goes directly to the left upper limb area, and the brain blood supply is reduced. And when there is brain blood supply is reduced, for this condition, actually supply not reduced, there is draining of the excess amount of blood. For this condition, the brain usually DG develop, sometimes syncope, sometime unconsciousness develop. So the subclavian still syndrome is associated with stenosis or occlusion of the subclavian artery. So there is the occlusion or there is a obstruction of the subclavian artery, and it is usually proximal to origin of the vertebral artery. And what occurs when there is increased metabolic rate? That means when there is hugely increasing of the vertebral, hugely increasing work or hugely increasing food material digits in case of the hand. So when the activity of the hand increases, so in this condition it needs more metabolic product, and for this condition there need more blood. So more blood supply goes from the blood from the brain, so the brain is deprived of the blood, and the symptom of this CNS vascular insufficiency develop. So you can see this is the another picture, and it is a good picture, I think. So here we can see this area, that means the left subclavian artery. In this question also they are showing the left subclavian artery. So the left subclavian artery stenosis. So when this hand activity increases, so what happen? Blood comes from the brain and goes to this affected side, and for this condition there is decreased amount of the blood in the brain, and finally there is the dizziness, vertigo, there may be unconsciousness develop. So what is this syndrome? This is the subclavian steal syndrome. When the question they denotes this is the DG. So in this condition, and there is a history of the increased physical activity, actually increase the activity of the hand. So in this condition, what is probable cause? The probable cause is the subclavian steal syndrome.